Live now with more about foods to eat and then foods to avoid.
Yeah, it's probably pretty obvious, but you know, we all need a refresher. I'm joined by Dr. Nita Bajor, who is a triple board certified physician. She joins us from Oakview Medical Associates in Greenville. So thank you for joining us today.
You're welcome. Thank you.
And before we go into the foods that are good and bad, let's go into what inflammation is. I feel like it's a very hot topic because it can be associated with so many illnesses and conditions. So explain what inflammation is in the body.
So inflammation is our body's immune response to either injury or infection. So not all inflammation is bad. In fact, when you have an acute infection like a cold or sinus infection, our body's blood cells come to fight that infection, and that's an inflammation response. When it becomes bad is when it becomes chronic and tends to abnormally trigger the immune system to then cause damage to the blood vessels and the tissues of our body.
So when you're chronically inflamed or continuously inflamed. Okay. And what are the factors that contribute to inflammation?
So overall, there are 5 factors that can contribute to inflammation. There's diet, your physical activity, your stress, sleep, and the toxins we take in, like tobacco and alcohol. Okay. But we're focusing on the nutrition today.
Yeah, I was about to say I think the biggest one is diet.
Yes.
Would you say that's correct?
Absolutely.
So let's go over what foods actually cause inflammation and can be really bad for you over the long run.
So the top 3 foods that cause inflammation, number 1 is sugar. So we have some
we got
cake,
here.
yes, and candy. And what that does is it turns on the oxidative stress in the body. So it damages the lining of the blood vessels and all the cells start leaking, and that can cause disease in different states. So like it can raise the insulin in our body, which then turns into a fat storage process. And then if you're storing fat, fat is inflammatory. So that's how candy and sugar lead to inflammation. Number 2 is the mayo there, which is processed foods and trans fats. And what that contains is refined ingredients that then promote the process of advanced glycation end products, which are called age ingredients. And that again promotes inflammation and leakage of blood vessels and also promotes cancer. The third one we don't have here is the processed foods and meats.
So, I see you have red meat on there,
red meat.
A lot of people are like, oh, really? Not
I know,
my steak?
I know it's hard to avoid, but you know, overall I think if you balance a good healthy diet and eat that in less quantity, that may be better than for some of us who can't go to completely plant-based. But red meat is actually linked to cancers like colon cancer, so something to keep in mind there.
And we have margarine on there. Would you say that's in line with the mayo and some of these
so that's
fats?
Refined oils like corn oil, soybean oil, that again, what happens in the body is that they stick to protein, fats, and carbohydrates and create the sticky substance that then clogs up our blood vessels. So the number 1 disease that bad foods cause is cardiovascular disease, coronary, but that's not the only one. They cause a lot of inflammation in type 2 diabetes, obesity. Obesity is linked to about 40 cancers. Then we also have autoimmune diseases like rheumatoid arthritis, lupus. You know, those are all linked to inflammation.
And let's go into the anti-inflammatory foods. I see we have a healthy array here.
Yeah, so if we can load up on healthy foods, number 1 being the green leafy vegetables like spinach, kale, collard greens, Swiss chard, very healthy. They contain vitamins and minerals that again help reduce that oxidative stress on the body. They carry away the free radicals and clean up the blood vessels. The second one there is the berry family. In fact, all fruits, but berries specifically, contain flavonoids and vitamin C, which again help reduce the oxidative stress on the body. Then we have fruits and nuts, which also will help in omega-3s, which are healthy. Omega-6s are bad. Those are the ones from refined foods. So, you know, there's good food here can really go a long way. Food is medicine, and it can really, I always with my patients, even if we're dealing with heart disease, high blood pressure, diabetes, we always give them a good meal plan, give them options of what to eat, what not to eat. My patients laugh because every patient gets like a diet handout on the way out. You know, it's good information, and it always helps them along the way. So.
All right, so try to stick to those veggies, leafy greens, some fish, saw salmon on there.
Fish too, yeah.
And very much limit your sugar and red meat. All right, thank you, Dr. Bajor, for joining us.
You're welcome.
Covering the